Good afternoon and welcome to today's virtual edition of MedTalks. First of all, special thanks to the Sunshine Coast Credit Union, who are always supportive of our efforts and are the financial sponsors of MedTalks, both live and in this virtual space. My name is Joanna Piros, coming to you live from beautiful downtown Gibsons. Very proud to be sitting on the board of the Sechelt Hospital Foundation and also to serve as your MC for these conversations around mental health, resilience, community support, etc., etc. So, it was just about a year ago. You might think back where you were about a year ago when you first started hearing the news about this virus that was spreading around the world. I remember I was out of the country for not even 24 hours when we got a phone call saying everything's going into lockdown. You should come home because you'll be quarantined for 2 weeks. And so, in fact, it was. So over this past year, we have all been challenged with personal loss and anxiety, fear about our economic well-being, all kinds of things that have gone on. So as we always try to do in MedTalks, we want to hear from you. We want to hear your questions. Feel free to use the chat feature. We'll do our best to answer those at about 2:45. All right, today we do not have a panel. We have a special guest who is an expert and a great communicator, and I'm really looking forward to you all hearing from Vikki Reynolds. So Vikki is a friend and a very familiar resource to healthcare here on the Sunshine Coast. When it was still okay to gather in person, she had over 100 healthcare staff in a seminar on resisting vicarious trauma that was extremely well received. She also did another piece for our mental health and substance use team on the opioid crisis as it impacts us here on the coast. So we've been talking over time, we've talked about frontline workers as separate from us, and we started to realize that to some extent or another, we've all been on our own front line, whether it's looking after our children at home while trying to work virtually, whether it's looking after aging parents who are in isolation, whatever it happens to be, we've all had a bit of a taste of that. So right away, we thought, who better to talk to us about it than Vikki, because she has both experience and science behind her. Vikki is an activist and a therapist. She works to bridge the worlds of social justice activism with community work and therapy, and she is going to help us deconstruct burnout. So Vikki, welcome to MedTalks. And first of all, are we burned out? What is burnout?
Well, thanks so much, Joanna. Really appreciate being here. I'm coming to you from the Indigenous territory, the Musqueam, Squamish, and Tsleil-Waututh people in East Vancouver, and I do remember very fondly being over in that community last year, and yeah, big respect for everything everybody's doing. So the question, are we being burned out? I'm not sure that's the right language. I have a lot of concerns about the language of vicarious trauma and burnout, in particular because it's mental health language that speaks as if we are somehow lacking mental wellness. When in fact, what's happening is we are responding to something that's very real. This is not happening in our synapses or in our brain. It's actually happening in the real world between people. So I don't know, the language of like whether or not we're burned out. So for me, I don't think about, the language of vicarious trauma is actually based on ideas that clients infect us with their hopelessness. That's a direct quote from one of the psychiatrists that started vicarious trauma. And I think, my work, I've been doing this work supervising teams for about 3 decades now, running the Center for Survivors of Torture, Rape Crisis Center. I was the addiction supervisor in the downtown east side. I work a lot with homelessness and responding to the overdose catastrophe. That's where all these teachings come from. So my job has been across time trying to keep workers alive in the work and spirited and, like having some sustainability, especially in situations that are extremely difficult because of structures of oppression and hardship. And in that work, the idea of thinking about people as burned out or vicarious traumatized, I think it's language that can get weaponized against workers as if somehow they're not doing enough self-care, when in fact there is something very real that's going on that's structural. So I don't actually think about it as burnout necessarily. I'm not sure that's the right way to describe what's happening to us now. I do think what's happening is a real enforcement of isolation and practices of isolation. And we are very social creatures. We keep each other ethical, we keep each other spirited and alive. And so I think all of these structures, I think like there are very real things that are going on, but I'm not so sure burnout or vicarious trauma really describe them. For workers, the way that I think about it is that if we're actually able to think about what's at the heart of our work, why did we come to this work? What are the ethics and values at the heart of the work? And then if we're able to actually enact those things, that we can have sustainability. But it's times that we're actually required to do things that aren't ethical. I think about people working in shelters who have to turn away youth because there's no youth shelters. Having to be a worker in the middle of the night telling a young woman she can't come into a shelter, what happens to you then? That's not burnout, Joanna, right? That's spiritual pain that says, here's my ethics, here's the heart of the work. I came to this work to help people, and I'm turning a young woman away in the middle of the night because we don't have enough shelter. All of the self-care in the world is not going to make you feel better about that, and nor should it, right? So right. I think that's actually about spiritual pain. I think some of what's happening is when we can't deliver ethics to people, we're experiencing a spiritual pain. And the answer for that is collective care with other people, solidarity, and getting ourselves back to our ethics. That can keep us alive in the work. Those are some that I'm thinking.
Yeah, no, I hear you. So, Vikki, we're conscious of the fact that we have in our audience, we have members of the community as well as members that are working on the front line in healthcare. Can you extrapolate out that as to what's the impact on those of us who aren't technically front line? It's diminished, obviously. It's not nearly as severe, but I think it's just as real, right?
Oh yeah, I don't, and so I think what's happening is the real impacts of isolation. I think the answer. Think about what does mental wellness mean to you, culturally, spiritually, intellectually, in your own life, in your lived experience, for your family of choice. What is it to be, mentally well? And for all of us, everybody's culture is a communal culture. There's no culture of isolation and separation. And then here we are in COVID where we've been so isolated from each other. My mom's going to turn 92 this month. I'm not going to see her. I'm an Irish Catholic girl. There is nothing okay in my culture about not attending to your elders in these spots in their life, right? Christmas, my family did not gather, right? All of these things that are real ruptures. It's not about not being able to go to the Bahamas or see the sun this winter. I mean, on some levels it is, because people have regulated their lives to have these kind of breaks and we didn't get it. That's just inconvenience. But there are things that are not just inconvenience. There are things that really rupture the fabric that hold us together. Our mental wellness is never an individual project. It's always social. And so these ruptures, with other people, those are the things that actually land. I would say, I respond to death and darkness. I always have in all of the work that I've done. Since COVID hit, I've had the hardest year of my working career. And I used to run the Center for Survivors of Torture. I mean, I work in hardship and I respond to the opiate catastrophe. So I'm working in death all the time. But, I've got a sister. My baby sister is a COVID long hauler. And she's been sick since last March. She's in Toronto and I have not seen her. I'm terrified for her. I just need to see her and hold her. And I can't. We can't do that. So, I've ramped up my self-care and I've decided I've got to be really rigorous about being mentally well and stuff. But there are things about that kind of disconnection that absolutely land. That is very real. And that's not anxiety and that's not depression. So I'll tell you what I think about anxiety. Anxiety, if I were to interview you for an hour, Joanna, as a psychotherapist, and you meet the criteria for anxiety, we would diagnose you with anxiety. I'd get you to somebody who could give you a prescription for an anti-anxiety pill. You'd take it. Over a short term, you'd start to see some differences in your relationship to anxiety. Those experiences would go down. That's not going to happen with this because it's not anxiety that's happened to people, right? It's dread. There's some real fear. This is real. And there's isolation. These are real things. This isn't happening in your brain, right? And the other one is depression. I don't think people are getting necessarily depressed. I think people are getting isolated. One of the things I know from working with survivors of torture, and basically I'm an adjunct professor and I teach trauma. I know a lot about trauma. But in terms of depression, it's, you could see a healthcare professional and you might meet the criteria for depression, and then we would get you on an antidepressant again. After a certain period of time, that medication would come in and your symptoms would go down. But this isn't depression. This is actually really horrid things it's scary. There are things that are scary. There are things that are fearful. There's not knowing, and it's not happening in our heads. I think there is So I think there's some very real things that are happening. And so we have to have some practices of connection, and we have to have practices of collective care, that are going to offset this stuff, as opposed to looking at this as if everybody's all of a sudden mentally ill. I don't think that what's happening to us is mental illness. I think this is real disconnection. And what I know from working with survivors of torture is that, like psychosis and other kinds of very serious psychological traumas and harms, they're all about massive disconnection, not being able to connect with other human beings. In fact, I know everybody listening doesn't want to hear a lot about torture, but in fact, torture isn't random, it's studied. And one of the things that torturers are trying to do is instill in people a terror that, Joanna, if you and I were standing together and you were yelling for my help, I would not help you. That you are totally disconnected from the human family. That is the stuff of torture. That is terrifying, isn't it?
Yeah, so, the stuff of nightmare.
That's the stuff of nightmare. It's the stuff
no one can hear you scream. Yep.
100%.
Yep.
So this idea that you don't belong in humanity, it's about the ruptures of relationship, connection, and what I talk about is an ethic of belonging. And that's been taken a very real hit this year. I'm worried for like all kinds of people who's all of their, we were worried about people's disconnection 2 years ago, right? And now this has just been ramped up. So that is extremely real. And there are things like you've been, you and Jane, when we were talking about this conversation, there's very real things and practices that are going on that are exacerbating this level of disconnection and harm, and then there's things that can be like an antidote or a resistance to that, right?
Let's talk about those then, Vikki. I know one of the things I was really taken by when you and I spoke a few weeks ago is this notion of not just being disconnected from others and from our society and from our culture, but being disconnected in ourselves. And I thought that was a really powerful concept. So talk to me a little bit about a disconnection from self.
Okay. So basically, if you were to take my trauma course in my master's class, this is all you need to know. Trauma is just disconnection. It's being overwhelmed. And it's disconnection. Disconnection intellectually with your own sense of being, disconnection with your heart and your sense of the sacred and the spiritual, disconnection with your physical body, a disconnection that exists between people, like my disconnection from you, Joanna. Look at us. We're meeting on Skype. And and there's even a delay. It's so strange. We would have been sitting close to each other. We would have been able to feel each other's breath and, be attuned to each other's body. There's a whole social poetics. Social poetics is the language that exists outside of words between people. All of us are not hearing that. We are hearing if in the music of life, we have lost the backdrop, which is this interconnection of our bodies with each other. We're not singing to each other. We're not harmonizing each other. So that spirited connection with other people, we've lost our connection with other bodies, and we've lost our connections with Mother Earth. I'm in East Vancouver. I can't get into the ocean. I can't go to the Sunshine Coast. I can't go to Ontario and see. I'm from those territories, the Mohawk territory and stuff. There is real disconnection, right? So I think that this level of, if we think about trauma as being overwhelmed and it being about disconnection, it makes a lot more sense. It's not a mental illness that's going on with us. There's very real things that are disrupting the fabric of our connections, and that is landing. That's landing, right? Because the problem is always disconnection in any kind of trauma, and the answer is always connection.
So the disconnection from ourselves and from others, how does that manifest then? How are you seeing that manifesting in people? As you say, we're not mentally ill, but we are doing things maybe that aren't the best for us as a result of that disconnection. Is that true?
Well, what I'm feeling because most of my work is with workers working in the margins, right? Like responding to the opiate catastrophe and other things. What's happening is people are not being shouldered up by each other. People are not feeling revolutionary love and solidarity. People are feeling this disconnection and isolation. And then even when, I love the pictures of nurses that started, I think their resistance started early on, the nurses that put pictures of their face and their bodies on their uniforms when they were all like hazmat suited up when they're going in to see a person. That's a real resistance to that kind of thing. But certainly these practices of isolation are landing on people. There's no doubt about that, right? So it doesn't matter what job you're doing. everybody's work is about relationships, right? All of our work is relational work, right? So you have, like where I live in East Van, I live on Commercial Drive, feels a little bit like Gibson sometimes, right? Like it's got that small town, we know each other feel. When I go to my coffee, I'm not looking the other person in the eyes. I mean, I'm looking at their eyes, but I can't read eyes. I don't have training for that. I need your whole face. So with the mask covered, it's very disruptive. I don't try to talk to people as much because you're not supposed to. You know, when you try to talk, you're actually sending more stuff. So I have a little puppy that I walk around the block. You know, the way to meet your neighbors is to share your puppy. I don't even, you know, we're not talking to each other about our puppy. So like all of these, everybody's life is getting disconnected, real practices of disconnection. And I think about that disconnection in even, for example, how much of their work has gone online. And even when it's working really well, you know that there's a fractional disconnect between me looking at you, Joanna, and what's actually happening. My brain is very busy every second trying to catch up to that. I'm telling myself that I'm following you, but there's parts of my brain that are working really hard. That's why Zoom exhausts people. It's one of many things. But like, just for example, it is so much more work for us cognitively to be working in these kind of distances because we're not built for this. We're relational people. So everybody's job, you get so much back. I think about the people at the pet food store or, you know, my grocer. We're not talking as much to each other. And I'm standing further in line. I'm not messing with where I live in East Van. You know, everybody's saying, oh my God, where'd you get that tattoo? What's that from? You know, while you're waiting in line, all of that's gone. Like all those little fabrics that make this is a very nice, queer, you know, working class, interesting neighborhood. It's gotten a lot less interesting this last year, especially then the other thing is this idea that every person is potentially going to infect you. Like that is real. We have to, so there's the disconnection, but there's also, this isn't just morality. There's the reality. We're supposed to stay away from each other. And I don't know about everybody else, but I'm Irish. I'm Irish Catholic. I grew up in a clan. My people are from Newfoundland, Ireland, England. I'm one of those people who's a space invader. I miss physical touch and contact brutally. And in my work, you know, I know my work is meaningful. I know a lot of workers really appreciate me and they tell me that. It's not the words people say that feed my soul and keep me sustained and resist burnout in my work. It's a spirited connection between people. And that has been really disrupted. And it's being mediated on a screen. And you know,
yeah, I one of the things that really resonates with me is that whole notion of the possibility that anyone can infect you. I have such a visceral reaction, I find, when I'm walking down the street and somebody goes out of their way to cross the street to the other sidewalk. You have this visceral reaction of, oh my God, what is wrong with me? But that's exactly what we've all been now encouraged to do. So let's talk, before we talk about ways to get around some of this or to help ourselves through it, let's talk a little bit about the impact of news media, facts versus non-facts, and technology. And we've talked a little bit about the technology, the screen divide, but let's talk about information overload and doom scrolling and all that stuff.
Yeah. Well, so one thing that's happened is the United States clown show is kind of over, you know, and I don't even want to follow American politics, but as a Canadian or a citizen of the world, you ignore American politics at your peril. They have set a tone, right? So this morning, anyway, there's something like the new president, Biden's got like a 65% approval rating in the United States. This just let me exhale. That's a higher approval rating across the whole country than the last guy got on any day in 4 years. Why that matters is I've been a bit worried. I have a lot of family in the States. There's a lot of political things that matter. Just to know, like, hey, that little kind of, that catastrophe or, you know, that circus is getting under control a little bit. Now they're going to be able to do things like respond to COVID, because I'm worried as somebody on the board. I want to be able to go back and see my family there, you know, my extended family there. You know, they need to do their bit and they're not. So that's been very real though. And so it wasn't just what they're doing about COVID. They, you know, that attack on the Capitol was an insurrection against democracy. I'm 60. We haven't seen that in our lifetimes in there. Those kind of things, you can't just ignore that. And so, but that, can really lead to doom scrolling because you think you need to know a whole bunch about that. So here's the stuff I give to most workers. Don't worry about American politics anymore. Just don't give it another thought. And think about this as your guilty pleasure. If you're going to do this, you're eating an extra donut. I mean, you can do that, but don't beat yourself up about it. Get back on your plan, which is your plan. And nothing about, I'm not talking about disordered eating. I'm talking about when you've decided you're not going to do something and then you do it because it's not good for you. What I talk about is a real sense of media.
Literacy?
Well, more than that, like resistance. It is absolutely captivating, right? And so, I don't want to have a phone, but I have a phone. I have to have a phone. It's when my work is crisis driven. I have to have it on me. This is horrible, right? But I don't need to respond to every call that I get and every invitation I have. So one of the things that I tell people about with everybody that I'm supervising is find a reputable site that gives you, here's what I follow every day. I follow what's happening in the world for COVID. I look at the world chart. I look at what is happening in Canada by provinces. And then I look at British Columbia. And I look at, how many new infections there are, how many folks are in the hospital, how many people are in ICU, how many people may have died, I think about that. And then that's it. If there's something I want to watch, like there might be a 3 or 4 minute clip on the news about the vaccine, okay, I can watch that. But I can't watch 20 of them on the vaccine. And once they've told me, oh, it's slowing down. Okay, I know it's slowing down. That's the information you have. It's slowing down the delivery. Stop. If you keep following that, you're going to get scared that you and the people you love are not going to get a vaccination. That's where that goes. And you're responsible for that. So just set some boundaries. And the other thing is, nothing against, nothing. I mean, of course, I have a critique of the media. Everybody does and stuff. But they are trying to keep you watching, and it's all the same story. You don't need to watch 20 stories about the fact that we didn't get as many vaccines as we thought we were going to get, right? And I believe in having a healthy critique, but there's a real problem with us spinning this and getting into that doom scrolling. So I tell people to, set, and I have them set on my site. I don't go looking every day. I've saved them so that I don't spend time looking for them because that's how you get trapped too. You start to go other places. And I just check those kind of things daily. And then I tell myself, okay, that's where we're at today. And I need to respond to that. And let's face it, lately, that's been pretty good. That's been, and so that is one reality about having a real discipline about media, but also having discipline in your conversations with other folks. Like one of the things I think that does happen when people, quote, burn out or lose the centers, we can move towards cynicism. We can move towards negativity. And if you keep going with negativity and you don't get bolstered up and held up and sustained, that negativity will move to cynicism. And once you go there be dragons. That's when there's no good news that's going to land, right? Where, someone's got something saying, hey, the government actually has secured enough vaccines. And they think we're pretty much on target for the fall for everybody, for most Canadians. And people are like, oh, no, that's not true. And starting to tell you 2,000 stories. I'm like, no, there are basic facts we need to support, and don't but that's when someone's really driven to cynicism and disconnection, like a real disconnection from that, right?
Yeah. And I think we're seeing, I'm sure you've noticed it too, some cynicism. At the very beginning, Bonnie Henry could do no wrong, right? She was Saint Bonnie across the board. And now I notice even in the comments when there are the live news conferences, comments saying, oh, this is nonsense. Oh, they're not telling us, oh, this is a lie. This is all blah. So that cynicism and we've swung, it seems like a very Canadian thing. We swung from putting somebody on a huge pedestal all the way over here to saying, oh, that's nonsense. She's just being told what to say for political expediency. So is that the kind of cynicism you're talking about that starts to spiral?
Dr. Bonnie Henry always wears good shoes. She wears flu bogs. I just like seeing her. What I appreciate about Dr. Bonnie Henry is she has taken such a beautiful stand from the beginning that we don't want to involve the police. We don't want this to be a policing exercise.
Right.
She wrote 2 years before COVID, she wrote a report as the head of health saying, the police and criminality ought not to be responding to the opiate catastrophe, which we know has killed way more people. So she's got this kind of practical, look, let's be good citizens and neighbors kind of approach that I like. And I think, I think this province has, I think we need to honor, it's amazing, isn't it? I think the head in every province is a woman, and many of them are women of color, and our head doc is a Canadian woman who's Asian. I mean, this is pretty cool. That's very different than what you were looking at in American media, right? Which was like very politicized. Like what we've done a good job. Remind yourself, we've done a great job. Whether you agree with Dr. Bonnie about things or not, it's not politicized so much. I mean, I'm not saying it's a neutral project, but one thing I hugely respect about British Columbia is look what we have done with the few vaccines we've got. Indigenous people, elder people, people in the downtown east side, and there's been no backlash for vaccinating people like in the downtown east side, homeless people, people's really precarious health. The reality is these are exactly who we should be vaccinating, because folks in the downtown east side, people who are homeless, people who struggle with substance use and that kind of with that precarious health, if they get COVID, they're going to be in the ICU. So it actually makes sense for everybody to vaccinate the most vulnerable. And that is something we've done. And I haven't heard backlash from anybody about that, which is amazing. So like, I think remind ourselves, I'm not trying to, you and I were talking about hope earlier. I'm not trying to say be optimistic, be Pollyanna, everything's great. Everything's not great. But there are things we are really getting right here ethically, which is taking care of the most vulnerable. I stand by that and I honor that. And I think Dr. Bonnie's been a piece of that. So remind yourself. So here's the other thing I think all the time, because, I'm just a therapist. But the reality is there's the things you do and the things you don't do. And one of the things that'd be lovely for everybody to reflect on who's listening to us, Joanne, is think about the things that you aren't doing that would make this worse. Because there's so many things we could all be doing that would make this worse, right? And one of the things that's happening in this province is they're not doing things to make it worse. And we had we had that rich couple fly up to the Yukon to, jump the queue and stuff like that. There was moral outrage about that. And that made me love British Columbia. It was just like, yeah, there should be, I don't want them to be worried about their safety or anything like that. But I think a story like that, people's response to that spoke to the ethics we have, which is that's for Indigenous folks and isolated communities. That's not for you, right?
Yeah, so it's not fair, basically.
It's not fair, but it's also not ethics, right? Because fairness and ethical are different projects, right?
Yeah.
So fairness is about the law. It's not because it was against a rule. It's because it wasn't just. It's unethical to take.
Absolutely.
This is the morale. And so morality is not always a problem. We have some great morality going, right? So when I think about, so there's the things that you might be doing that might make it better, but make sure you're not doing the things that make it worse, right? Like that doom scrolling, massive negativity. Again, I don't listen to Dr. Bonnie too much. I just want the numbers. I don't want to listen to that for an hour a day. And I was at the beginning trying to get a handle on this. So, and I do think, of course, this is going to be imperfect. One thing I've also appreciated in Canada versus the States, and I don't think it's going the same now, but was trying to not politicize this and everybody just getting together to try to do the best job we can. That's a spirit I'm trying to hold on to.
Right. So I love the idea of repositioning what you're doing. I think it's a little bit like when people stop smoking or something like that. So rather than saying, I'm not having a cigarette, it's I am a non-smoker. So putting up more of a positive frame around what you're not doing to make things worse. What else can we do, Vikki, to help ourselves maybe compensate for that lack of connection? I know you talk about self-forgiveness too, which is maybe not a concept that occurs to most of us. Like, why should I have to forgive myself for what?
I'm not sure about that. Like in terms of practices for connection, here's what I think about that. I work very hard at connection. I think mental wellness is inextricably linked to collective care, not just self-care. So there's self-care practices. I've always done those because, like everybody, my work is hard, just like everybody who's listening here. Everybody's work is hard. And I don't want to get into, a pissing contest about pain. It's like, oh, I work with survivors of torture. and I work with the overdose, so I have to do more self-care. I think everybody's required to care for themselves. But self-care only does some things. It doesn't do anything about the social determinants of health. Self-care doesn't do anything about the inequities of poverty, about growing homelessness in the Sunshine Coast, right? Self-care is to get you more resource to be able to be more of use in your life to others, for yourself and others, right? It's that collective care is the stuff that can actually, move us forward. So when I think about that, like just for example, when I started to do my PhD, I became a real total nerd and I was writing and reading all the time. And I dropped off sending birthday cards to everybody. My partner picked it up, but I used to make them, really think about you, who you were as a person and all that stuff. And I stopped doing that. When COVID hit, I was like, okay, you know what? What I am missing is not being able to get to the Sunshine Coast or go surfing in Tofino. I mean, my Christmas got canceled. Okay. That's just inconvenience. That's privilege, right? You know what, just to get back to Bonnie a little bit, she does say this thing, we're all in this together. We're not all in this together. Poor people, unhoused people are absolutely suffering way differently. This is not hitting people the same. Since we got rid of CERB, the $2,000 a month, a whole bunch of poor people and working class people have had to go back to very dangerous work and take great risks and stuff like that. But what I think about is that collective care. So what I did this Valentine's Day, I have all kinds of great nieces and great nephews. I sent them all pop-up Valentine's Day cards, and told them that I love them because I miss them. My family's in Toronto, and I usually get there 4 or 5 times a year. I haven't seen them in a year. That's huge for my great nieces and great nephews. One of them just turned 16, and I wasn't there for her 16th birthday, But you know what? She texted me today and said, "Great Aunt Vikki, thanks so much for my Valentine's Day card." And it just really warmed my heart. I don't think 2 years ago I would have let that land. So it moved me. You know what I mean? I think we are all being open to tenderness more. We are all really seeing the value of relationships we may have taken for just taken advantage of or disregarded in the past. Oh my goodness. So I've tried to create rituals of inclusion and rituals of collective care. I think those are things people can do. One of the other things, and I'd say this as a therapist, is because we have lost the possibility of this social poetic, the language that exists between our bodies, that exists outside of words. We have all got to find a language of connection that we didn't need before, So for example, my family has a family Zoom meeting and stuff like that. When my nephews say something that's really meaningful, I touch my heart, and I just wanted to know you touched me. You know what I mean? I think we have to language the body. I hope that doesn't sound too therapeutic, but it really is. We actually have to tell people, oh, Joanna, when you said that, I felt I can really feel that. I got a bit choked when you mentioned that, or say something, because it's not apparent to people the response and impact we're having with each other. And again, that's that severing of connection, right? So we need to do purposeful things to connect. One of the other things I think that everybody can do, if you're on, if your work or it requires more Zoom and more online stuff, try to get offline as much as you can and go for a walk. Just say, okay, Joanna, if you and I are having a conversation about how today's call is going to go, instead of Zooming again, I'll go for a walk, you go for a walk, and let's talk to each other and move our bodies and get out there. You know what I mean? And try to connect in those kind of ways. I think we need to find responses for that social poetic. We need to find new practices of connection. We need to language the body. And I think the other thing is people are creating new rituals with each other.
Yep.
What I think about all the time is I want to create the conditions that invite you to the warmth of a fire. I want to have a fire in my backyard and have you come there. One of the things I started to do during the opiate catastrophe was because I was I don't want to do more talk therapy with all these workers. Is there something else I could do? And I was consulting with another clinical supervisor, and she said, "Oh, it sounds like what you want to do, Vikki, is invite people to the warmth of a fire." And, I rent a beat-up house in East Van. I have a lovely landlord, and he lets me have fire. So I started to have a fire every month in my backyard that all kinds of folks from the downtown east side, from the overdose prevention sites, would show up and just sit together at a fire. And sometimes people would burn something. Sometimes people would say something or read a poem. Sometimes people were quiet with each other, you know. Sometimes people wanted witness and sometimes they didn't. But that connection. So now I've been thinking, okay, how do we create rituals and connections with the warmth of a fire and that kind of gathering online, you know? So many people are doing interesting things. Like my one nephew, Peter, he's a wizard online. He's got everybody showing up for these family meetings. He's teaching everybody who doesn't know how to do it, how to do it. But he's also started having everybody make your dinner. We'll eat dinner together and tell us what you're cooking and what you're making. It just helps set a tone that we're not just talking about how much I miss you and how awful it is that I can't hold you and touch you, you know?
Right. It's actually sharing an activity that's a totally normal activity, and we're sharing it together. You're chopping in your kitchen, I'm chopping in my kitchen. We've got our little devices, whatever, helping us there. I really love this idea of languaging the body. And when you talked earlier about nurses putting photographs of themselves on their masks, I think that's an example of that, right? They came to that organically. I want someone to know who it is behind all of this gear. And so that, I guess that's a really good example. I would like.
I think that's a great example of like a resistance to disconnection.
Yeah.
I am a nurse. I am not an autonomon. I'm not a machine. I am a human being here. All of the ways in the past that nurses work is inherently relational. Nurses are always counselors. I always think, you know, that the work is about relationship. Nothing happens without that. And then all of a sudden, nurses are asked to do work with people who are very afraid in things we don't know what we're doing, and they have to do it without any relational capacity they have. I can't imagine how heartbreaking and hard and puzzling that's been for nurses. That's not burnout, and you know, yoga and self-care is not going to fix that. Acts of resistance and reconnection are going to fix it. I mean, you need self-care, but that's a real beautiful act of resistance against the disappearance of the humanity of the nurse, because they are in relationships with people. They're not fixing cars. They're actually in relationships with people. And again, if you want to think about that idea about social poetics, if you want to know a lot about that, watch a nurse. They don't ask intrusive questions. They don't get too touchy-feely with everybody, but they create relationships of respect and dignity that bring safety to people and help people co-regulate so they feel that they're going to be cared for. I mean, it's extremely skilled work that healthcare providers do, and then all of a sudden you're supposed to do that without the bodies connecting. Like, it's just wow. And people have been finding ways, right?
Yep. Actually, this is a perfect opportunity to dial Jane McDonald in. Jane is, of course, the executive director of the Sechelt Hospital Foundation. And Jane often goes out to the healthcare staff, including nurses, and says, hey, we need you to do this. And they're like, yes, sign me up. So Jane, tell us a little bit. This is our little promo for the respiratory assessment clinic. Yeah.
Hi, everyone from the Hospital Foundation office here at Sechelt Hospital. I did start my day a couple times last week, and one morning, this actual morning, stopping by the respiratory assessment clinic there at Seaside Center. And what an amazing team of both doctors and nurses who are servicing all the testing for our community. And they were more than willing. I didn't even have to bribe them this morning. They were happy to share the news of what the community needs to know. And so we filmed a little bit of a rough clip. Sorry, I'm not the broadcaster in the family here, but maybe our friend Taryn can show the respiratory assessment clinic.
Hi, welcome to the Respiratory Assessment Center. We accept appointments only. You can phone or text this number, and you'll be asked some questions by the person that answers the phone about your symptoms and how long they've been there. And then they will book you an appointment. It's often same-day appointments, which is really lovely. And you come to our center and we test you in a couple of different ways. And then you get your results in 24 to 48 hours, making sure you isolate while you're waiting for your results.
There are two ways to perform the test for COVID-19. We can do a nasopharyngeal swab, a little bit of discomfort as we perform the swab. It takes only about 10 seconds. The second option is to do a saline gargle test. Give you a little tube of saline, ask you to swish it around. For that test, you must not have had anything to eat, drink, brush your teeth, or smoke a cigarette within the last hour for us to be able to do that test. And then we get the results in 24 to 48 hours.
back to you, Jane. So what we normally do, Vikki, and I think you know this, we have asked for questions from the audience, and they can come in through the chat in various places. And I think Jane has been curating some of those questions. So you'll be back on the spot answering questions from the audience. So Jane, if you've got some for us, that would be lovely.
Sure, that came in from one of our physicians this morning. Oftentimes, people cannot or do not know how to admit that they suffer from burnout, or as we've called it, spiritual pain. How can their friends, family, and colleagues identify this burnout or experience? And what should they do if they think someone close to them is suffering from this?
Well, I think that's a great question. Because I believe in collective care. I mean, part of collective care is having the moral courage to be able to offer a person a critique, especially if it's a coworker. I mean, that's most of what I'm talking about. So that spiritual pain I talk about is, you know, we come to this work. What's at the heart of your work? You come here, you know, to be of use to people. And then, you know, if we start to do things, you know, that are not ethical, or we start to move to enmeshment, getting too close to people, or disconnection, getting too negative, you know, if you knew that's what you were doing, you wouldn't do it, right? You can't keep yourself well. Like, that collective care is absolutely required. So I think we have to have relationships of respect and dignity that, you know, Jane, if you start to see me getting sharp with everybody, cutting people off, not being as available, that kind of stuff, you know, often we would just let that stuff slide, because the Canadian society is really about a politics of politeness. We would rather be polite than useful. You know, I can tell you in group theory, we know this in groups, running groups. I'm talking therapeutically here. If someone in a group has something useful to say to somebody, if they think they don't remember the person's name, or they might not pronounce it right, they won't tell them. Because I would rather not be useful to you, even in your recovery, than I would risk me doing something imperfect or something that might get seen as rude, right? So one of the things we're up against is the politics of politeness. It's not more ethical to let someone be that disconnected and start to cut people off and be rude and uncaring, right? That, you know, like, we often smooth things over between us, so we don't want to tell people that, but what's actually, that person's on a road to burnout that's actually it's gonna escalate into other ways until they maybe disrespect or hurt someone that's a client, you know what I mean? So I think we have to have the moral courage to offer the other person like a critique or some feedback that just says, hey, Vikki, like, do you have a second? I care about you. I know you're an ethical person. You've been kind of short with me and others for a while now. I'm wondering if something's going on. Like, I think that invitation into accountability, this is hard work that requires moral courage. And this is why on our teams, and I think in our friend groups and work groups, we have to create relationships of respect and dignity. The point is not for us to like each other. The point's for us to respect each other so that we can actually be useful to each other when you see somebody slipping out of, you know, that connection, slipping out of, you know, the ethical place in the work and starting to slip to that disconnection or enmeshment. The stuff of burnout, when you start to watch that in somebody, don't let that go. You know, collective care means you actually reach out and help that person in. So and to do that, you don't start having these conversations when it's tough. We need to have conversations and make commitments to each other for our collective care that, you know, where I invite you that, hey, you know, Jane, if you ever catch me, you know, doing anything that's not ethical or not the heart of my work, if you let me know, I will treat this like a gift. You know, critique is always a gift that the person who gives it, it's hardest on the person who gives critique. It's not the hard thing to receive it. I always receive critique. I try to remind myself to exercise practices of gratitude and say, thanks, Jane. I imagine that took a lot of courage for you to tell me that. Thanks so much for telling me. Then we can start to have this conversation. Again, I think it goes back to, Joanna, the conversation you and I were having, like, we've got to language the things that are happening. And I think in a culture that prioritizes kindness and politeness so high, we can risk actually being useful and loving to each other, you know?
Mm-hmm. Jane actually has a beautiful example of kind of that collective care that was demonstrated just a couple of days ago. Yeah.
our entire healthcare team, every department, every role, every contractor, every physician, every nurse received a handwritten, made with love Valentine, similar to the ones you made, Vikki, from our Sechelt Rotary Club. I believe they delivered over 988, to be specific, handwritten Valentines, each with an individual little coffee coupon in them, and as well some beautiful bouquets of flowers for our various health units. And it was such an incredible outpouring. It's like handing a healthcare worker a gold brick, to think that someone did something without any expectation, just to say hi and we appreciate you. Keep up the great work. And so that was a bit of a shared hug, and even the folks in laundry and housekeeping received them, and they're keeping us all safe. So nice to see those moments. We've had a lot of them throughout 2020, but it's also, as everyone is a little bit sort of growing tired, these moments of joy are just incredible to share.
And I suspect, Vikki, you would say that the people writing and creating those Valentines also took a lot of energy from that too, right? So it's not just as we know, it's not just the receiver.
Yeah.
What a great practice, right?
I think it's these practices of gratitude, right? And about, from the 12-step movement talks about giving it back practices. There's something really meaningful about being able to give it back to people. And one of the things I believe that's a principle of sustainability, a principle that's a resistance to burnout, you have to have a knowing in the bones that your work matters. And I'm talking about paid and unpaid work, and I think about the fact that you mentioned, Jane, the inclusion of people who do the cleaning and the housekeeping and security, the people that don't usually get counted as the quote real workers. It's all the real work. The lights don't stay on without the administrator. There's, everybody is a piece of this, so that, recognizing everybody in those kind of ways really matters, because they, that helps you understand that this actually matters. Yeah, that knowing in the bones that your work is meaningful. And I think that that's been very hard for people to hold on to with all of this disconnection, right? And the other thing I think about is, like I said, for example, my sister who's a long hauler, she's scared every time she goes to a hospital, as she should be. She's terrified of getting reinfected or something else happening. I think everybody healthcare workers are in front of have more, it's not anxiety, they have more concerns than they had 2 years ago. There's no, actually, I'll tell you this, I love my dentist. I'm somebody who's got a ton of money in my mouth so that I have a smile. And, when COVID started, I was supposed to see my dentist, and of course, her practice closed for about a year. So I saw her last month. They called me, and I was just thinking, oh my God, I'm gonna have to find another dentist. How can this, anyway, they called me. I took her a dozen roses. And, and I just said, I am so grateful. She's older. She doesn't need to work. She could have retired. This is risky. I am just so grateful that she would care. And she was like, I can't I'm not going to retire by being kicked out by COVID. I'm going to make sure I pass all of you on in a good way. She came on probably for a year or two to make sure that everybody didn't see a dentist for a year, that we're okay. Her work matters. Everybody's work matters. Joanne, I think this is what you're speaking about. We are inextricably linked to other people. This is what I mean by these kind of connections. Yeah. And I just, I brought her those roses, genuinely, I'm I am so moved that you still have this care for me. Your work really matters to me, because dentists, as you know, they're one of the healthcare groups where more people cancel than ever, and everybody doesn't want to see them. Yeah. They're not met with gratitude. And I'm I would not have teeth in my mouth without you. I so appreciate your work. And I speak for a living. I couldn't do this without a dentist. So I think these, when you start to, I think COVID has dropped a lot. I'm very hopeful in many ways, I have to tell you, as an activist. Not hopeful optimism, believed in hope, hard-won hope. I'm really hopeful that COVID has dropped the veil that we're all in this together. We can see the inequities of our society more than ever. I think we are committed to doing something very different with our elders from here on, at every level, every government, every party, every community. This isn't on anybody in particular. I think Canada as a whole, I thought Trudeau spoke well about this a year ago, saying this is a shame on Canada that our elders were this susceptible and vulnerable because we haven't cared for them the way that we need to. And I think there's 100 invitations there for us to get things right. So while it's been vulnerable and awful, there's also a new, I think, collective commitment that I find believed in hope. I believe that more people care and have been disrupted. Everybody got scared, you know, and the fear is not held equally. Some people have homes and money and they're going to be fine. Other people really lost like a great deal, and other people have lost their health. But everybody got scared to a point where we can think about, I just think it just gets people to rethink, saying, how do we want to structure our society? How do we want to do things differently in a very real way? And that to me is extremely hopeful.
There could be a whole nother program, I think, on what has COVID taught us? What have we learned? I love that idea that it's dropped the veil on some of the inequities that we've just taken for granted along the way. Jane, I'm sure, do you have more questions? I'm sure you do.
One was, I think, talking a bit about the exhaustion and a bit about I don't want to say burnout, but that's sort of today. So we've all set a few milestones and goalposts to aim for during this pandemic. And so at first it was, we just need to get to the summer and then all will be well. Well, that didn't happen. And then if we get past the second wave, then we'll be okay. Well, that didn't happen. And then once we recover from having too many Thanksgiving dinners, then we'll be okay. Or now it's a new year, so then it's going to be okay. And in reality, it's still a bit of a waiting game. And this is the new normal. So any tips or tricks on how to resist the cynicism or how to effectively ask for help if we're falling into that hole, or any other ways to deepen our connections?
Yeah, well, I think one is I think one is the political reality. This is about inconvenience. This isn't about the risk of your life.
Right.
For some people, their lives are up at stake. Healthcare providers are doing very dangerous work with very sick people. That's scary. Missing my mom's birthday is a hardship, and it's sad and it's heartbreaking. It's not the same, so I think one thing is acknowledging this is going to end, and things will be different, but things are not going to be the way they've been this last year. Like that's I do think we have to resist the pessimism of this is never going to be over. That is not true. It's not for me to say when it's going to be over. I'm not an expert who could speak on that, but things have been moving in a good way. And so I think one part of that is like just acknowledging this is, like I said, this is landing on people very differentially. So I think those practices of gratitude, like I rent a house that has a backyard. And I just remember I've gone out every day in the winter, no matter how nasty and ugly it is, because I have a backyard. And I'm just like, oh my gosh, I also invited other people to come use my backyard who are renters, who are in apartment buildings that have no outdoor space. So they'd come to my back. I've had a friend come over and they had a fire in my backyard that I wasn't at so that they could use it because they're stuck in a little apartment, right? Like thinking about how do we share the resources we've got right now? That wouldn't have happened 2 years ago. And now I'm like, oh my gosh, I've got a house, that you can have a fire in the backyard, and I haven't shared that with anybody. That makes me feel a little bit mean. And it's like, that's not going to happen again. I think there have been these like practices of sharing, like collective care. But to get more to your question, Jane, about people like setting the goalposts and the goalposts continually being moved, I think one thing is get real. Here's what I'm thinking. Because I lived in Botswana, Africa at the very beginning of AIDS. I lost the family that I lived with in the village, all of my students. I've never gone back to Botswana because too many people died during the massacre that was AIDS in the third world, right? I've never gone back to that. This is something that is very different. I think one thing, instead of just setting goalposts, like if you remember, because I'm going to be 60 this year, those of us who remember fighting AIDS, it took a decade to find out what the problem was. And then it took years to and a lot of activism, right? Because the people who were dying were queer, gay, drug users. And so there wasn't a lot of investment in ending it. And then there was a lot of activism, and then we got medication, and then Big Pharma was making huge money off it. People couldn't get access to it. Now, AIDS is something you can live with. I'm not saying we've licked it entirely and that stigma's gone, but that is amazing, right? Well, I never imagined we would get a vaccine in a year. Because I lived through AIDS in a visceral way, I lost so many people to that. I am so amazed, and I've had people say things to me like, it's like a war. We're in a war. And I'm like, it's not like a war at all. I work with people from wars. The whole world this year has conspired together to keep you alive. Everybody in the world, every scientist in the world has been trying to make a vaccine to keep you and everybody you love alive. That is not a war. In a war, there is malice and there's a real intention to kill you. So I just think like let's be careful of the metaphors we use. And I also think, again, Joanna, like you were saying like maybe a future conversation is what's come forward. All kinds of great Canadian scientists, like at McMaster University and others, shared their research before they got it licensed or put their name on it. You know what I mean? Like the generosity in the healthcare and the science community has been amazing. I am concerned about like my biggest concern is why isn't the world organizing now to say, get rid of the copyrights on this? Why aren't we using like India and other countries that could make enough vaccines in 6 months and have the whole world vaccinated in 8 months? So like that's a conversation we need to have. But I do think, it is amazing. There's more than one vaccine. There might even be more coming. And then one of my friends who's responding to the opiate catastrophe that I've been very worried for, their life is very precarious and their health and all that stuff. They got their first vaccination like this month. And I can't tell you how hopeful that is to me. I think you have to be really burned out and cynical to be able to look at the people that have been vaccinated and think, this isn't good enough kind of thing. Like, I did not imagine we'd have a vaccine at this point. Like, we really do. And it's not like optimism. It's real believed in hope. That hope is hard work. That is absolutely real. That is real, and people fought hard for that. That's something to be proud of. That didn't just happen. And it's believed in, and then what's the next thing we can believe in,
Was it Emily Dickinson that said, hope is that thing with feathers? I think it was. What I'm hearing you saying, Vikki, is that let's start paying attention to the right things. Let's start paying attention to the good things that have happened. The fact that we do have a vaccine in record-breaking time. The fact that people are going out of their way, that are exercising. I love the message that acts of kindness are acts of resistance. I think that's a fantastic message to take away, and to exercise gratitude as a way of generating that collective care versus just worrying about, as I know you always say, never mind the bubble bath and the yoga. Let's think more about what we can do for other people. And from that, we will derive our own self-care by caring for others. I think those are incredibly powerful messages. And I thank you so much for bringing them to us. Jane, we have a whole list of resources, yes, on the website that we wanted to let people know about. Oh, and we also want to hype Vikki's website. If people want to know more about Vikki, I think Taryn has maybe something to show us. Vikki's website is Vikki Reynolds, that's with 2 Ks, as you can see right below her, VikkiReynolds.ca. There are some great video clips there where Vikki talks about the opioid crisis and lots of really interesting little bite-sized pieces to look at, more information about her. And sorry, Jane, I threw to you and then I took it back. So resources on our website.
Yes, and that is also along with all the MedTalks that we filmed in 2020 as well. So if anybody wants to watch any of the previous editions on developing our collective resilience and or even some of our guided meditation practices, those are all on the Sechelt Hospital Foundation website.
Wonderful. And as always, we love to hear from you. Do just email us, get in touch with the foundation. If there are topics that you would like us to tackle in MedTalks, in upcoming MedTalks, we always like to hear your suggestions, because the whole point of putting this series together was to respond to needs that were being expressed in the community. We are here for you, essentially. So let us know what you would like to do, what you would like to hear about, what you'd like to talk about, and we will do whatever we can to share that, to collectively build our own gratitude. So Vikki, thank you once again. Jane, thank you once again. Taryn in the background, thank you. That is it for us. I'm Joanna Piros. It's always a pleasure. Bye for now.